1.9 million brain cells. That is the number that neurologists at the American Stroke Association have calculated die every single minute that a stroke goes untreated. Every 60 seconds of delay, 1.9 million cells. Gone. A stroke that is treated quickly, where the person survives with minimal disability, and a stroke that causes permanent paralysis, lost speech, or death. The difference between those two outcomes is almost entirely determined by what happens in the first few minutes. Not at the hospital. Before the hospital. In the first 3 minutes, while the ambulance is on its way. Most seniors have heard of stroke. Most know it is serious. Most have seen the famous FAST acronym: face, arms, speech, time. But knowing a word is not the same as knowing what to do when it is happening, to you or to someone you love, right now, in this room, before any professional help has arrived. Today, we are covering exactly that. 5 specific, medically supported actions recommended by the Mayo Clinic, the American Heart Association, and the CDC that can be taken in the first 3 minutes of a stroke. Actions that protect brain tissue, preserve treatment options, and give the best possible chance of the outcome everyone is hoping for. This is one of the most important videos this channel has ever made. Please watch it to the end, and please share it. 60 seconds of essential context, because understanding what is happening changes everything about why the 5 actions matter. A stroke occurs when blood flow to part of the brain is disrupted. There are 2 types. An ischemic stroke, responsible for approximately 87% of all strokes, occurs when a blood clot blocks an artery supplying the brain. A hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing bleeding into the surrounding tissue. Both types deprive brain tissue of oxygen. Both begin causing irreversible damage within minutes. And critically, the actions taken in the first few minutes affect both types in the same way. Because in those first minutes, before a scan has been done at the hospital, it is impossible to know which type is occurring. The window for treatment is specific and urgent. Medical professionals can administer clot-busting drugs within 4.5 hours and mechanical clot removals up to 24 hours after the start of stroke symptoms. But the sooner treatment begins, the more of those 1.9 million cells per minute are preserved, and the better the outcome. Everything you do in the first 3 minutes either protects that treatment window or closes it. Here are the 5 actions that protect it. Before you can act, you must recognize, and recognition must happen fast, because the most common response to stroke symptoms is the most dangerous one. Waiting to see if they pass. Only an estimated 36% of people in the United States know even one of the signs of a stroke. That gap between knowing and not knowing is where lives are lost. The American Heart Association and American Stroke Association now recommend the BE-FAST acronym, an expanded version of the older FAST tool that catches more strokes, including those affecting the back of the brain that FAST can miss. B. Balance. Sudden loss of balance or coordination. Not dizziness from standing up too quickly. Sudden, severe loss of balance with no obvious cause. A. Eyes. Sudden trouble seeing in one or both eyes. Blurred vision, double vision, or loss of vision that comes on instantly. F. Face. One side of the face drooping or feeling numb. Ask the person to smile. If one side droops, this is a warning sign. A. Arms. Sudden weakness or numbness in one arm. Ask the person to raise both arms. If one drifts downward or cannot be raised, act immediately. S. Speech. Slurred speech, inability to speak, or difficulty understanding what someone is saying. T. Time. Time to call emergency services immediately. One critical point from every medical authority on stroke: call 911 immediately, even if the symptoms appear mild or disappear. Symptoms that resolve may indicate a TIA, a transient ischemic attack, which carries a very high short-term risk of a full stroke and requires immediate evaluation. Call emergency services. This is not advice. It is the non-negotiable foundation of everything else on this list. Every other action exists alongside this one, not instead of it. When you call, say these exact words. They are the words that trigger the fastest possible emergency response. I think this is a stroke. Telling the 911 operator, I think this is a stroke, helps get you to the hospital immediately. These words activate stroke protocols, the specialized pathways that mobilize stroke teams, prepare CT scanners, and fast-track the patient from arrival to treatment. Then provide 3 pieces of information the operator needs immediately: the location, the time the symptoms first appeared. This is critical for treatment decisions, and the person's main symptom. Note the time when symptoms first appear and share this information with emergency healthcare professionals when they arrive. The 4.5-hour window for clot-busting medication is counted from the time symptoms began, not from when you called. If you cannot confirm exactly when symptoms started, the treatment window may be calculated more conservatively, potentially excluding the person from the most effective interventions. Note the time. Say it out loud. Write it down. It matters more than almost anything else you will do. Do not drive the patient to the hospital yourself unless otherwise advised. Wait for paramedics so they can begin treatment before they arrive at the hospital. Once emergency services have been called, position matters. The correct position protects the airway, supports circulation, and prevents additional harm while help is on the way. The correct position depends on the person's level of consciousness. If the person is conscious and able to respond, place them in a comfortable position, preferably on their side with head and shoulders slightly raised and supported. Avoid moving them unnecessarily. A folded jacket, a firm pillow, or anything available can support the head and shoulders. The slight elevation of the head and upper body supports blood flow dynamics and reduces intracranial pressure. If the person is unconscious, vomiting, or having difficulty swallowing, position them lying on one side with their head slightly raised and supported. This is called the recovery position, and it is critical because stroke severely impairs the swallowing reflex. A person flat on their back who vomits during a stroke faces a very high risk of aspiration, inhaling vomit into the lungs, which can be fatal independently of the stroke itself. Loosen tight clothing such as collars or scarves. Cover them with a blanket or coat if they are cold. Maintaining a comfortable body temperature reduces physiological stress during the acute event. The things not to do in terms of positioning. Do not give the person anything to eat or drink. You do not want to give the person anything to eat or drink for fear of choking if they are having trouble swallowing. Do not give aspirin. Do not give them any medications, especially aspirin, because if they are suffering a brain bleed, the aspirin could put them at greater risk. Aspirin is appropriate for some ischemic strokes, but since you cannot know which type of stroke is occurring without a hospital scan, giving aspirin during a hemorrhagic stroke directly worsens the bleeding. While waiting for emergency services, your role is to monitor, communicate, and document. 3 things happening simultaneously. Monitor breathing. Check to see if they're breathing. If they're not breathing, perform chest compressions or CPR. If they're having difficulty breathing, loosen any constrictive clothing. If the person is conscious, speak to them calmly. Reassurance reduces anxiety and physiological stress during an acute event. Ask them their name. Ask them to squeeze your hand. This continuous assessment tells you whether their condition is stable or deteriorating. Stay on the phone with the emergency operator. Keep the phone on speakerphone next to you so you can tend to the person while hearing the 911 operator. The operator is trained to guide you through each moment, including if the person becomes unconscious or stops breathing. Do not end the call. Document for the arriving paramedics. Write down or photograph, on your phone, the following information: the exact time symptoms began, any medications the person takes, including blood thinners, any known medical conditions, particularly atrial fibrillation, high blood pressure, diabetes, or previous stroke, or TIA, any allergies. This information directly affects the treatment decisions made in the first minutes of hospital arrival and can save critical time during the handover to paramedics. The final action, and the one most people have never thought about, is preparing the physical environment for the paramedics who are on their way. Every minute paramedics spend navigating obstacles is a minute they are not treating the patient. Clear the area to make it easier for EMTs or paramedics to access the person. Move furniture, bags, or any obstacles between the front door and where the person is lying. If you are the person experiencing symptoms yourself, unlock your front door before sitting or lying down so paramedics can enter without delay. If there is a pet in the home, secure them in another room. This sounds minor. It is not. An agitated dog can block paramedics' access and extend the time between arrival and treatment by minutes that carry a measurable cost in brain tissue. If you live in an apartment building, send someone to meet the paramedics at the building entrance and guide them directly. Every floor navigated without guidance adds seconds that compound. Turn on exterior lights if it is dark. Clear the doorway completely, and stand where you can be seen from the street so the paramedics identify the correct address immediately. For the significant proportion of seniors who live alone, this section is the most important of the entire video. If you experience stroke symptoms and you are alone, the sequence is specific and critical. First, call emergency services immediately. If you cannot speak clearly, which is possible with stroke, stay on the line. The operator can trace the call. Any sound you make, tapping the phone, breathing, signals to the operator that someone is there and needs help. Second, unlock your front door. Before sitting or lying down, before anything else after the call. Unlock the door. This single action ensures paramedics can reach you even if you lose consciousness before they arrive. Third, get to the floor safely. Do not try to reach a chair or sofa if you feel yourself losing balance or strength. The floor is the safest position. It eliminates the risk of a fall injury on top of the stroke. Slide down a wall if possible. Get as low as you can, as safely as you can. Fourth, lie on your side. The recovery position, even if you're conscious, protects your airway if symptoms worsen before help arrives. Consider a medical alert device. For seniors who live alone, a wearable medical alert device that connects to emergency services with a single button press is one of the most practical and genuinely life-saving investments available. When a stroke makes dialing impossible, a single button press does everything the phone call cannot. The 5 actions in this video are for the moment a stroke happens, but the most powerful stroke intervention available to any senior is the one that prevents it from happening in the first place. The CDC and American Heart Association identify these as the most evidence-based stroke risk reduction strategies for adults over 60. Manage blood pressure. High blood pressure is the single leading cause of stroke. Manage your blood pressure, cholesterol, and blood sugar. Know your numbers. Monitor at home. Take prescribed medications consistently. Walk daily. Regular physical activity reduces stroke risk by up to 27% in older adults through its effect on blood pressure, blood sugar, cholesterol, and vascular health simultaneously. Eat a stroke-protective diet. A diet rich in vegetables, fruits, whole grains, and fatty fish, and low in sodium and processed foods, directly reduces the arterial inflammation and plaque accumulation that drives ischemic stroke. Treat atrial fibrillation. AF, an irregular heart rhythm, is one of the most significant independent stroke risk factors in older adults. If you have been diagnosed with AF and are not on appropriate anticoagulation, this is a conversation to have with your doctor this week. Never ignore a TIA. Half of severe strokes occur within 48 hours following a TIA. Symptoms that resolve in minutes still require immediate emergency evaluation, because the window to prevent the following stroke is narrow, and the interventions available within that window are highly effective. Here is what we are asking you to do in the next 5 minutes. Not a challenge, not a protocol. 5 minutes of preparation that could change everything. 1. Write down or save the BE-FAST acronym somewhere visible in your home: the refrigerator, the bathroom mirror, your phone wallpaper, balance, eyes, face, arms, speech, time. 2. Make sure every person in your household knows to call emergency services immediately, before any other action, if they see any of these signs. Not watch and wait. Call immediately. 3. Ensure your front door can be unlocked quickly from the inside. If you live alone, consider whether a medical alert device is worth the investment for the peace of mind and the genuine protection it provides. 4. Know your blood pressure number. If you do not know it, make an appointment this week to find out. And 5. Share this video with every senior in your life, with every adult child who lives far from an aging parent, with every family who has never had this conversation. Only 36% of people know even one sign of a stroke. Sharing this video with 10 people moves 10 people from that 36% into the group that knows all 6. That knowledge, in the right moment, is the difference between 1.9 million brain cells per minute lost and a family member who walks out of the hospital. New videos every Tuesday. Thank you for being here. Thank you for watching to the end. On-screen end card. And next Tuesday. 5 things seniors must stop doing. Immediately. Most people have no idea these are harmful. 5 completely ordinary daily habits that the research says are working quietly against your health after 60, and the simple replacements for each one, linked right above. We will see you there.